Okay, thank you. Let's go for our last part here, in which we're going to talk about treatment of dentin hypersensitivity. And in fact, the treatment of dentin hypersensitivity needs to be used with clinical procedures, but also we have to put a very positive psychologically approach. This means that our patient needs to understand that we are confident in what we are doing and that we know what we are doing, because dentin hypersensitivity as a chronic pain has an amount of placebo effect. But also, besides the fact that we have different treatment strategies, we have to control the predisposing factors, and this is of utmost importance. And one of the things that needs to be thought about is that there is a vicious cycle of dentin hypersensitivity, which means you have dentin hypersensitivity and then you cannot clean your teeth well. This leads to inflammation. When you have inflammation, you are going to have more inflammatory mediators. And when you have these more inflammatory mediators, you're going to have more sensitivity and then difficulty to have a better, good oral hygiene. So this cycle needs to be broken. And if it needs to be broken, we have to think that instruction in oral hygiene is part of the treatment. This is, we have to treat the patient and we have to instruct him or her to perform adequately oral hygiene measurements. And also we have to limit the process of gingival recession and use the acid drinks and foods rationally. As we have talked in the previous blocks, reducing acid intake or making an intelligent consumption of acids, or a rational consumption of acids, this will lead to less predispositional for dentin hypersensitivity. And one of the recommendations that we have, if the patient does have dentin hypersensitivity, he needs to wait 30 minutes to brush his teeth after he eats. Remember, when we thought about the etiology in the first part of our presentation, we remember that there is a higher diameter of the tubules and an increased amount of tubules when you are exposed to acid. So actually we have to use this information because the treatment should be based on the etiologic knowledge. And two main kinds of measurements we have today. One of them is limiting or elimination the movement of the fluids, and the other one is trying to decrease the stimulus conduction, depolarizing the nerve fiber. And a series of different forms of treatment have been proposed in the literature, and we're not going to talk about all of them, of course, but we are going to take a look or take a glimpse in some of them which are very important. As I have previously mentioned, the Pro-Argin technology is an effective treatment, and as I have answered to Lina, it is truly reversible, but it needs to be a continuous treatment. And we're going to base this information on a very important professor, which is called Nicola West, which has published in 2015 a very comprehensive literature review. And from what she has said, with taking a look in the quality of the evidence, we're going to base our presentation here. Of course, we have in-office and home use products. Some of them we are going to talk now, especially the in-office in the beginning of this part. So fluoride compounds are very effective in decreasing dentin hypersensitivity. What happens? It happens that the calcium fluoride binds to the tooth surface and then has a higher diameter than the dentin tubule. So it occludes because it's a bigger diameter than the dentin opening tubules. And this is a layer that might be removed by the mechanical friction. So in terms of fluoride components, we have normally rinsing solutions, professional application of gels, normally neutral and not acidic, and also varnishes. And the varnishes, they have the advantage that they have an immediate effect because they occlude the tubule, and this helps the patients to increase the expectancies in terms of the treatment, increasing the suggestion power. So actually, when you use something like Duraphat, we have here the demonstration that there is an effectiveness of Duraphat. Duraphat is actually extremely helpful in decreasing dentin hypersensitivity. We're not going to talk about all of these different types of in-office treatments, but we're going to talk about also the home use products. And in the home use products, we have an emphasis in the arginine calcium carbonate products, which are the Pro-Argin technology. The Pro-Argin technology is something that was created by the University of New York in Stony Brook by Dr. Israel Kleinberg, and that was further bought by Colgate. The patent was bought by Colgate. And I had the privilege to be part of the group of persons that were making deep thoughts about the technology previously to the launching. And actually, arginine is an amino acid that helps to carry phosphate and calcium to the interior of the tubule, forming a plug. And this goes back to the question from Lina, in which the effect is more long-lasting than the others because of the plug. So even though it's not forever lasting, it is long-lasting because there is this plug. And if we go to see here, you're going to see the occlusion of the tubules, the complete occlusion of the tubules helped by arginine. So the Pro-Argin technology is today very, very useful, and it is considered, yes, it is considered the gold standard treatment for dentin hypersensitivity. So how does it really work? Arginine is a natural amino acid and an essential element for cell growth. It is naturally found in saliva. So it comes from plants, it comes from seeds, fermented food, in yogurt, for example, and it's considered safe by FDA, for example, to be used in feeding. So how does it really works? Arginine is positively charged and is polar, and the tooth surface is negatively charged. And calcium carbonate has a zeta positive potential, and this means that the tooth surface, which is negatively charged, will attract arginine, facilitating the binding of calcium carbonate. And there is a bunch of evidence supporting this situation. And here is, for example, a comparison between the use of the Pro-Argin technology with the Novamine technology. And we're going to see that there is a better effect. This is an in vitro study of occlusion of the tubules when we use Pro-Argin versus when we use the Novamine technology. Also, we have results in different forms of studies. This is Pro-Relief compared to potassium citrate, and we are going to see in red that the better scores come here for the Pro-Argin technology. When you take a look of other studies, this is reduction, so the better is the higher. Both in tactile and in air blast evaluation, we are going to see that this is a technology that in the dentifrice makes a difference. And this was used prior to tooth polishing, and this is really something which was very interesting. I had the honor to participate in what Colgate calls the Prove It program, which was a program that we used a combination between Duraphat and the Pro-Relief technology. And here are the results of 10 patients of mine, in which we compared after 4 weeks the results, and we're going to see that after 4 weeks we have a great effect. See here at baseline, numbers go from 6, 7, a lot of 9s and 10s. Immediately after the application, these numbers go to 4, 3, and 2, and 4 weeks later, almost half of them are in grade 0. This means completely healed. So when we go for a testimonial about this, we'd say that the use of CSPR plus Duraphat in a regimen has a strong potential for healing dentin hypersensitivity. And the patients experience a strong and immediate effect that lasts. So this goes again back to Lina's question. It does last, not forever, but it does last. And this regimen is an effective treatment for dentin hypersensitivity that demonstrates high degree of response from the patients. The decrease in dentin hypersensitivity increases quality of life of the patients, making eating, drinking and smiling easier. So really you change quality of life in individuals. And if we go back to the review of the literature that I showed about by Nicola West, we're going to see that the Pro-Argin technology is one of the therapies, or the only therapy that she graded as with high quality evidence. There is comparisons of other drugs that really, drugs or cosmetics also, but other treatment approaches that do work. But the highest quality evidence is supported by, is supporting the use of arginine and calcium carbonate. So it can be used in three forms. In home use as a dentifrice, which is very good because if you use a dentifrice, you are using a toothbrush. Using a toothbrush, you are also decreasing inflammation. Decreasing inflammation, you are decreasing the chances of hypersensitivity. Can be done with the application with the finger, which is also a very nice form, which has strong evidence supporting it, or by professional application. So actually, if I would make a conclusion of what we have today, the gold standard for dentin hypersensitivity is the Pro-Argin technology. I'd like just to briefly remember you, we have now in Brazil, Colgate Brazil has the new Colgate Total 12, and this is based on microparticles of silica that occlude the tubules. So it does also function very well. It increases the tactile sensitivity, which means this is decreased pain, and in the air blast, it goes up to 8 weeks, remembering the time of action that it does. So actually, the new Colgate Total with this silica also has an effect. But it has to be remembered, the gold standard is the Pro-Argin technology. However, we have a problem here. We have a problem which is that from individuals that do have dentin hypersensitivity, only 17% of them utilize an anti-hypersensitivity dentifrice. This is extremely bad because the dentifrice is a very good ways of using as a vehicle for treating dentin hypersensitivity. So in my view, this is a space that the profession and the industry have to increase both awareness of how awareness that dentin hypersensitivity can be treated with Pro-Argin technology, for example, and this needs to be spread because people are not aware that dentin hypersensitivity can be healed, and if the patient has pain, he is in worse quality of life. So I would like to start finalizing my speech here today with you. Remember that we professionals, we have to make the differential diagnosis, we have to make preventive counseling, talking to the patients about prevention of dentin hypersensitivity, which is prevention of gingival recession. We have to topically apply fluorides, for example, Duraphat. We have to prescribe dentifrices, for example, the Pro-Argin technology, and we have other alternatives that might be useful as in-office therapies. But by now, as I remembered, the Pro-Argin technology is the best that we have. We also have to think of the responsibility of the patient, because the patient has to do adequate oral hygiene, has to utilize the prescribed agents, and has to avoid factors that potentialize the problem, for example, the irresponsible use of acids. And there is a responsibility that the patient comes also, but then the profession has a greater responsibility, which is research on the topic to the best possible evidence supporting a clinical decision process that cures the problem with predictability in order to give better comfort to the patient, increasing quality of life. So the profession has still to continue because we have gone very far, but we didn't come to the end. We still have space for having something which is as effective as we have, for example, a Band-Aid for other kind of healing. So I would really like to thank you very much for your attention. I am always ready and welcome your questions. And really I am delighted to be with you, because I understand that what we can do for the quality of life of the patients when we treat hypersensitivity is something that really matters. It's something that really impacts. This makes you a better dentist, makes the industry more effective, and makes the individuals and the populations healthier and happier, which is always what we want. Thank you very much.
Thanks a lot, Cassiano. It was a great presentation. Now let's check the last question coming from Terrell GTC.
Hello, I'm Thilo Path from the Turville GTC. My question would be, how does the Pro-Argin technology stand out of other technologies that anti-sensitivity toothpastes are based upon? Is it the clinicals, or are they other points of differentiation?
Thank you very much, Thilo, for your question. And actually, the evidence that supports the Pro-Argin technology is of strong quality, as I have demonstrated before. And it is considered today the gold standard. Why it is considered the gold standard? Because when compared to the others, both professionally and in-home use, it gets better results. What do we mean by better results? We mean that it is immediate, so it's less lasting in terms of the initiation of the process. It is more durable, so we have at least 3 months of duration. And what is very important is that we have also supporting data not only from clinical research but from in vitro studies demonstrating that the plug that is formed, it is resistant to acids. And this resistance to acids is very important so that the recurrence does not occur. So actually we understand today that in comparison with the others, especially with the same types, for example, the dentifrices that are sold either with strontium, with potassium, or different other salts, the evidence supporting is that the Pro-Argin technology is the best encountered today. So this is supported by head-to-head studies, and head-to-head studies, controlled, randomized, double-blind, really demonstrate the highest quality evidence which we have today, considering the Pro-Argin technology as the gold standard for treatment of dentin hypersensitivity. Thank you very much again for your question.
Cassiano, thanks a lot for your kindness and partnership.
It was a great pleasure to have you here. Thanks a lot for sharing your knowledge with us here and all Colgate team. Thank you.
Thank you very much for the attention of all of you. For me, it was a great pleasure to be in this activity today, not only because I could have the opportunity to be with friends here, but also because I am confident in the technology. I have participated in part of the history of the technology. And as a clinician, I am a periodontist, and one of the major problems of my patients, the adverse event of my treatment, is dentin hypersensitivity. So I cause also hypersensitivity, and I have to heal because it was caused by me. So, and I really had an input of very great importance when the technology came into the market, because I started to have much better results with my patients. And I also teach in the university, in which we are testing a lot of different things, and I can assure you that the Pro-Argin technology was something that really came as a breakthrough knowledge that was coming to us. So thank you very much for the attention, and we are always open to communications in our university. Thank you very much.
Thank all of you.
So be connected and check the other topics in the library. Bye bye. See you soon.
See you.